Thank you, Governor. Good afternoon, everyone. As always, thank you for being with us today. One way that you can help us is by being an ambassador. If someone in your life is not able to watch these press conferences on TV or online, help them stay informed by passing along the prevention messages and resources that we're sharing each week, each day. We'll continue to adjust to make sure that you have good, clear, accurate information, because that's one of the best tools in the fight against this virus, which we know is continuing. I'll start with an overview of the numbers. As the governor said, we have 52 new cases today. 59 people are currently hospitalized across the state. Of those 59 people, 5 are in an intensive care unit, and 3 of those people are on a ventilator. Sadly, we have 2 additional fatalities to report today. One of these people was in their 60s, and one of them was in their 80s. Our sympathies and prayers continue to go out to the families of these Rhode Islanders. Our number of new cases today at 52 is down from the 102 new cases that we saw yesterday. It's important to understand that, to make that clear. We have to continue to be vigilant. We are absolutely seeing social gatherings as a source of these new cases, whether they're social gatherings on the beach where people are close together and not masking, or social gatherings on boats, or social gatherings in homes and other places. We have to address this together with kindness and consideration, as the governor has shared. So we will be working with you. We can support each other in making sure people have masks, making sure that folks understand how this virus works and why it is critical. Contact tracing, which is also an important component along with testing, is now more complicated than it used to be as people are out and getting more mobile. They are coming into contact with more people, and that's why, with the forethought that was in place, we have the Crush COVID app that's so important for you to be able to download and use so that we can get the accurate information needed from people quickly and help us understand shifts that we see in our daily data and what interventions we can put in place to prevent the spread of disease. So if you haven't downloaded the Crush COVID app, please do so. That is another thing you can do. As the governor said, one thing that we do know unequivocally is that this virus is still with us, and it spreads extremely rapidly, especially when people are not wearing face coverings and when they're not practicing distancing socially and physically. We certainly know, if we see the types of numbers that we've seen at beaches continually, you will see increases in cases. We need you to be wearing your mask. We need you to be distancing effectively 6 feet or more, washing your hands regularly. You can use hand sanitizer, and keeping your groups consistent and small. Something else we need you to do is follow the quarantine and isolation instructions you are given by us at the Rhode Island Department of Health if you've been told to quarantine or isolate. It is not acceptable that we've seen over the last 2 weeks that times when we've called someone who is supposed to be in quarantine or isolation and are told that that person is not home. That is something that we are addressing, and we need you to do your part in correcting that. If you're supposed to be quarantining or isolating, the only reason you should be leaving your home is for medical care. That is the key way that we stop transmission of the virus. Staying at home and recovering, which is the isolation, or staying at home and monitoring for symptoms so that you do not develop them in public. We are here to help. We have resources and support for you if you need it, but please stay at home. When we call, answer the phone, and please provide the person you talk to with the information they request. That helps us be as effective as we can be. The only thing we will ever use that information for is to try to keep you, your loved ones, and the people in your community healthy and safe. Shifting gears very quickly, I want to give a brief update on serology testing as a main part of our overall testing strategy. We've spoken about the early warning system. Part of our testing strategy, and serology testing is a key component of that. We are excited to announce that we're launching a new COVID-19 serology testing effort. Serology testing looks for proteins in the blood called antibodies, which are produced in response to the presence of a virus or another organism. Serology testing, antibody testing, tells us whether someone was previously exposed to a virus and helps us understand how prevalent the virus is in a community and across the state. This will be our second round of serology testing. In May, we did an initial round, and in that randomized sample that we did, we found a seroprevalence of 2.2%, meaning that 2.2% of people who were tested had been exposed to the virus that caused COVID-19. This next round of sampling with serology testing will be open to people in certain high-contact professions in Rhode Island and to people in fields that have been on the front lines of the COVID-19 response. So this is going to be our starting point. As of Friday, first responders, Rhode Island National Guard members, Rhode Island Department of Health staff, correctional facility workers, and hospital and nursing home staff will be able to schedule a test online. For the first responders group, that means police officers, firefighters, and emergency medical services personnel. People in these occupations will be able to start scheduling serology tests on Friday by going to firstserosurveyri.com, that website. Testing will be entirely voluntary and it will be confidential. We will issue a press release this afternoon with more details, but I wanted to use this opportunity to make people aware. I also want to acknowledge Dr. Phil Chan, who's a consultant medical director at the Rhode Island Department of Health, who's been overseeing this effort for the department and oversaw our application to the Centers for Disease Control and Prevention to be a part of the serology testing effort. So we are one of just 3 sites across the U.S. that the Centers for Disease Control is offering this opportunity to: Detroit, New York City, and Rhode Island. So we can be proud of the work that we're doing to stay in front of and advance our early warning system by collecting the data that we can to help us understand the spread of disease. And we will continue to do our part and want you all to continue to do yours.